Hi, good evening. Okay, hi, I'm Callie Boyer. I'm the Director of Marketing for Promises, and tonight is another one of our Promises family webinars. So if you're joining us, you might have a loved one in treatment, in active addiction, maybe they're already in recovery. I just want you to know that we're glad you found us. So tonight we'll be talking about addiction as a disease. So George Danquah is here from Worcester. He's our clinical director for Washburn House, and he's going to be leading tonight's training. You can expect it to be around between 30 minutes, 45 minutes, I would say, George, maybe like at most an hour, I'm guessing. So if at any point you need to hop out, feel free. You can also, if you need to move into like your phone or something, Zoom will follow you. So if you have any questions about that, you can put a note in the chat and I can help you with any kind of Zoom issues that might come up. I also just want to encourage you tonight that if you have questions for George, you can put them in the chat. So you should see the chat there at the bottom. If you've already listed, like told us where you're from tonight, that's amazing. And if you have questions as we go through for me or George, you can put them there in the chat, and we're happy to check those out and help everybody understand this all a bit better. So George, if you want to go to the next slide, I'm going to introduce you. So I'm excited to introduce George. He's our clinical director at Washburn House for the um is I guess like the PHP program, outpatient program. So I think they now call it like low intensity. It has a different clinical name now. But anyway, George is a licensed alcohol and drug counselor and holds a Master of Social Work degree and brings a strong blend of clinical expertise, leadership, and trauma-informed care to his work. With extensive experience in substance use disorder treatment, mental health, and supporting individuals with complex needs, George has led programs focused on delivering high-quality, person-centered care. And his background spans clinical administration, case management, and team leadership, and has a deep commitment to serving diverse populations, navigating addiction, co-occurring disorders, and trauma. What really stands out to me about George is his compassion and grounded approach. So he leads with empathy, cultural humility, and a genuine belief in each person's capacity for recovery and transformation. I'm really glad that he's here with us this evening. And just so you all know too, like maybe your loved one is not at Washburn House, there's a really kind and considerate person like George at all of our facilities. Every time we have one of these trainings, whether it's through our family programs, we also host CE webinars. We're always bringing in our experts to give guidance, not just to the clients that they get to serve, but to our communities as well. So very happy you're here. You can go to the next slide. I'm going to speak a bit more about promises. So we have seven um, facilities nationwide, three in Texas, Promises Atlanta, Tennessee, the Ranch, Pennsylvania, and Washburn House, where George is. So um, I also just want to speak a bit tonight to our continuum of care. So these are all of our residential sites, and then we also offer outpatient services. So in Texas and Tennessee, we do telehealth services, outpatient being high intensity outpatient, partial hospitalization outpatient, and those are just step downs and step ups for residential care. So you might be sitting here with a loved one in residential care. Know that like we have next steps for you. So if you have questions about what could come next, you'll have a case manager that will help your loved one navigate that, but you can always reach out to us at familyservices@promises.com if you just care to learn more about what those treatment services look like and what that program entails. Or if you have someone in an outpatient center right now, maybe not even with Promises, you can reach out. We can give you some information on those residential programs. So across the board, these programs may all look a little bit different, but the excellence that we provide in that curriculum is the same across all the sites. So just know that you'll be well taken care of wherever you choose to land, wherever is most beneficial to you or your loved one. Um, if you have any questions, again, you can just email familyservices@promises.com, and we're happy to help you navigate any of those questions. I feel like there was something else I was going to add here, and I can't remember. So we'll just, if I remember, I'll come back to it. But okay, you can go to the next slide, George. think there's just one more slide from me, and that is to talk about our family support groups. So every month, in addition to the training, like you're here tonight, we'll have a follow-up meeting next week. And this is totally free, totally optional. It's just an open space for families, for you all to come and kind of maybe connect with each other a bit more. Like I have said, this night, is a recorded training. So next week is just, it's not recorded. Bill is our executive director with Promises Atlanta, and he's there with us every month. And so he just is able to kind of hold space for you all to ask your questions about treatment, about what comes next. And we're happy to like just sit with you as you navigate those changes that are happening right now. So that again is just held the same time, same place next week. You do have to register through CEGO like you did for this training. I'll drop a link to that here in just a moment when I pass this over to George. So next Tuesday, 5 o'clock, if you have questions that you want to bring to us, it might just be about something that you're processing from tonight's training, or it could be totally something different. We can help you navigate that. I remember what I was going to add. Okay. In addition to our treatment programs, everyone is included in our Rooted Alumni program, which is just our alumni group. So once you complete treatment or your loved one completes treatment, they have access to our nationwide recovery groups where they have in-person events, virtual groups that they get to attend. So that's what I was going to add is that if you have questions about that as well, we can talk about Rooted. So, okay. Glad you're here. Thank you guys for being here tonight. If you have any questions, again, I'm in the chat. If you have questions for George, you can put them in the chat and I'll pass this over to you. Thank you all.
Thank you very much. Right, so thank you for coming to join us this evening. I'll continue by also sharing a little bit about Washburn House here in Worcester. We are a premier addiction treatment program, and we are actually committed to compassionate evidence care. And we take pride in treating individuals who are dealing with substance use disorders and mental health challenges. We believe that treatment shouldn't be a one-size-fits-all. And so we, because of this, the Promises and Washburn House have done a good job to building a very comprehensive continuum of care. And I will take this time to explain what we have here in Worcester. So let's say somebody or a loved one is dealing with this disease of substance use and mental health, and they walk through our doors at Detox. So this is where we help them to go through the TIPA protocol. So they start with the medically managed residential detox. And then once they are done, they move on or they transition to the clinically managed high intensity residential, formerly called the CSS level of care. So here, this is where the actual work begins at this level of care. Our loved ones dealing with the disease begin to learn more about the behaviors that also fuels the disease of addiction. And then they begin to learn more about the disease, and then they learn about different strategies, coping skills to manage those behaviors that also contribute to the disease. And when they are able to complete this level of care, within our continuum of care, they can decide to move to outpatient level of care, which we call the clinically managed low intensity residential, and then the high intensity outpatient services. So here is a split. They can choose to go to IOP, and then they can choose to come to MIND program, which is the clinically managed low intensity residential. Here, we specialize in treating or supporting individuals who have co-occurring or comorbid condition. They have both the addiction and then the mental health, substance use disorders, and then mental health challenges. So then when they meet that criteria, they can come to our program and then we'll support them in a long-term treatment. So today, I want us to look at what we can get from our presentation today of everything that we seek to learn. Our goal here is to, by the end of this treatment, this session, people understand why addiction is a disease, and then be able to reduce the stigma that comes with us, the misconception or misunderstanding of thinking. And then we also understanding the intersection of mental health and substance use. And then also, we also look at family dynamics, identify the difference between enabling behaviors and then also empowering behaviors. As we've seen in studies that loved ones really struggle supporting their loved ones who are dealing with the disease of addiction. And most of the time, to the burnout due to the misunderstanding of the disease and not understanding how best to support their loved ones. And then we'll look at the pathway to recovery using the evidence-based treatment options. There are resources that can also support both the individuals dealing with the disease and also the loved ones or the families who are also trying to support them. Okay, my goal is to make this also very interactive. So I want to start with this question. And please feel free to put your answers in the chat. Very short answers, maybe 2 to 3 word answers, please. So if a loved one was diagnosed with type 2 diabetes, what is the first thing your family would do? So please feel free and provide short answers. If you had a loved one who was diagnosed with type 2 diabetes, what is the first thing your family would do? Okay, now let's look at this. Let's compare that to the first reaction most families have when they discover that their loved one has a substance use disorder. So this one too, I encourage you to put your responses in the chat. Now, my next question is, why do you think those reactions are so different? So have this at the back of your mind as we move on. We'll come back to this and then also discuss. Okay, now understanding the brain disease model of addiction, I want to take time here to explain why addiction is a disease but not a moral failing event. So, according to studies of neuroscience, addiction hijacks the brain's reward system, specifically the dopamine pathway. Okay, so the part of the brain called the frontal cortex, where it's the area of the brain where we as humans use to control our impulses and also to make decisions, rational decisions. Now, when the disease of addiction, when addiction is present, that part of the brain loses control. We lose control in that part of the brain. And so we'll lose the power to make rational decisions and to control the edges and then the cravings to wanting to use any particular substances in real time. And so when that happens, our loved ones don't have power to just get up and say, today I'm not using, or maybe I can use right now because it's not going to help me. I'm going to get sick. They don't have that ability anymore because that part of the brain is activated. And now they don't have the ability to make that sound decision or control the impulses. Okay, now let's relate this to diabetes. Okay, Diabe- diabetes 2, type 2, we know that a lot of individuals relapse because it requires lifelong management, medication management, life, changing lifestyle changes. And so that is also synonymous to the addiction, the disease of addiction. So because it also requires a lifelong management medically or learning about the behaviors and learning to manage and change them, where we use different evidence-based treatment modalities to help our individuals to change those behaviors, to manage them well so that they don't pick up and use. It is very common that we see individuals who have this disease often relapsing, just as in diabetes, we see people usually dealing with relapses, and then it keeps on becoming a cycling problem. And so the takeaway from here is that addiction is a disease. It hijacks the brain's reward system, which we call the dopamine pathway. And so when that happens, our individuals, our loved ones who are dealing with the disease, lose control of that part of the brain, which is the frontal cortex. They lose control of that part of the brain. So they are not able to control their impulses and they are not able to make rational decisions as to just saying that I'm not going to use anymore. And that is why we hear often when the family members are frustrated, they begin to label. So once we understand this, we can be able to learn to be more understanding as we move forward. We're going to learn how to be more understanding and then also change our language to be able to show support. I hope this is clear. Now, let's come to another question here. And this is the iceberg reflection. I want everybody to take time to really think about this. Imagine a person's behavior is like an iceberg. Above the water, we see the substance use, the late nights, the broken promises, the physical changes. What unseen factors do you think might be hiding below the waterline, driving that behavior? I wanted to take a moment to reflect on this. Often we hear people saying, oh, it's not going to change. We've heard this multiple times. He's always saying that this is the last time, but they keep on using. We hear people saying that we are tired of you. We can't trust you anymore. You keep doing this over and over. But beneath that, do we really understand the struggles, the unseen factors, the trauma, mental health conditions, do we actually understand our loved ones' struggles that drive this behavior of consistent and relapses in substance use? Hopefully, by the end of this session, we'll be able to have that understanding and be more accepting of being open-minded and maybe supporting our loved ones in a way that is also not going to compromise our health as family members. Okay, so let's go to the next. Let's look at understanding co-occurring disorders, dual diagnosis. So when an individual experiences both a substance use disorder and a mental health disorder, such as depression, anxiety, PTSD, bipolar disorder, schizophrenic disorder, schizoaffective disorder, we can go on and go on. So whenever you hear co-occurring disorders, it is an intersection, or it is when an individual has the addiction component, substance use, and also a mental health condition. So now our loved one with this condition is dealing with two major issues or disorders. Okay. Sometimes it could be the substance use disorder, the prolonged use of substances actually leading to the one developing mental health condition, or the mental health condition can be a precursor for the substance use disorders. Okay, and so when they come to our programs, we do comprehensive assessment and we're able to determine which one is the primary disorder, and then we treat. And so we commit to treating both and then helping them to receive that kind of care that will help them to be stable and be able to make those rational decisions and control their impulses. Okay, and then we have the self-medication cycle. So here, many individuals use substances to manage untreated psychiatric symptoms. In any case, somebody might be having anxiety, a typical example, and so they will go and drink or use substances to numb their behaviors, to numb their feelings, so that they don't go through the anxiety episodes. Okay, so anytime they begin to face escalated anxiety, or they see that the anxiety is progressing, most people with these diseases just go and then use substances or alcohol just to escape from those emotions. Okay, and so here, the term here we use for that is self-medication, and is very prevalent. Okay, so when that is the case, then we commit to treating this individual or supporting them with medication, and also with therapy to help them manage the mental health condition. And so by doing so, they will learn to also understand how addiction also affect them, and then they learn all these techniques and then coping skills to also manage the cravings and the urges. And so they become stable because now they are treating both conditions. Okay, and so let's look at what integrated treatment means. So research shows that both conditions must be treated simultaneously for the best outcomes. So that supports or is consistent with everything I've said so far. So we don't just treat one and leave the other. It is very effective to treat both conditions. And I would say about 90% 90% and above of the population, individuals with substance use also have mental health conditions. But when we look at research, it's probably about 67 to 70%. So the co-occurring or the dual diagnosis is prevalent among the population. And so we commit to treating them and then treating both conditions so that they can be stable and be able to live in dignity and then live their best lives, enjoy their best lives. Now, let's look at the impact on the family system. Having those two questions that were asked before. So eventually I'll circle back and then we'll give people a chance to weigh in. So usually, let's say the family roles. We have the hero, the high achiever, tries to make the family look normal. Okay. And then we also have the scapegoats, the problem child, who diverts attention from the addiction. And then we have the lost child, very quiet and withdrawn, usually avoids conflicts. And then we have the mascot, uses humor to diffuse tension. So here I want to provide more context or more information so that we can understand the family system very well and the different roles. So now we have the hero. The hero provides self-worth to the family. Okay, so this individual and the family function usually in the long term may develop alcoholism and then inability to relax. And then the one also playing the role of scapegoating also provides distraction or targets. And then the long-term effect here is lifelong legal or substance issues. And then the lost child reduces family burden. Usually, the long-term risks here is difficulty forming intimate relationships. And then the mascot provides stress relief. And then the long-term risk here is inability to handle serious emotions. And then the enabler maintains the family's status quo with the long-term effects of risk factor being severe burnout or loss of self. So let's look at the family. Let's look at what supporting our loved one who is dealing with the disease of addiction versus enabling their behaviors. Okay, so the enabling looks like motivation, action, results, and then the supporting fear of crisis, conflict, long-term health and growth. So let's look at this. When a loved one is using, and we don't want to hurt their feelings, and so sometimes instead of being firm and maybe speaking to them in a manner that we want to support them, we want to help them, because we don't want conflict. We just enable them. Okay, so here, when the enabling, the motivation, fear of conflict or crisis or conflict, it leads to a long-term health and growth. Action, cleaning up their messes, paying their bills, lying to bosses, these are examples. So we know that we can really support them in other ways that can help them to take responsibility for their actions and be more serious, even though we understand that they can make rational decisions. But we can help them in a way, maybe getting them to treatment and then setting some healthy boundaries. We keep up paying their bills for them, billing them from the court system, from prisons and stuff like that. And so it becomes a problem. Okay. But we can also set clear boundaries and consequences with love. Okay. So when we are able to set clear boundaries and consequences, we encourage the loved one to take responsibility. Because remember, we are talking about addictive or negative behaviors that drive the disease of addiction. Okay. But when we seek to avoid conflicts or fear of crisis, and we continue to pay their bills, continue to clean up their messes, our loved ones' messes, then we also end up prolonging the disease of addiction by removing the stench. It is a very tough situation, and I know that many of us on this with us today, I think I'm arousing a lot of feelings because almost those who have their loved ones dealing with the disease can find themselves going through or can relate to different phases of this. You know, at points in time, we have struggled trying to support our loved ones, and we keep bailing them out until we got burnout and we said we are tired. But then we got stuck. Okay, so now moving forward, we're going to learn how to support them, having this understanding. So, communication is very important in supporting our loved ones who are dealing with the disease of addiction and also mental health. Okay, and here, motivational interviewing is huge in our treatment. So we use this a lot, and so now I'm using the family's perspective instead of the clinical perspective, so that we can give you something to work with in supporting your loved ones who are dealing with the disease of addiction. Language matters. It is crucial. And so let's look at this. Okay. Open-ended questions. It enhances conversation interaction. And so one of the techniques or one of the interventions of the motivational interviewing is what we call the open-ended questions. Okay. So most families accidentally ask why, yes, no questions, which often feel like an interrogation. Example, why did you use? Why do you? Or did you go to your meetings? Okay. Open-ended questions invite the loved one to share their internal world without feeling backed into the corner. Okay. Usually, when we speak in this manner, we find our loved ones becoming very defensive quickly, and then we begin to see our emotions arousing, and then conflict surfaces. Okay, so let's switch this a little bit. So instead of asking these questions, what if we say, are you planning on staying sober today? Or else try, what does your support plan look like for this afternoon? Or why can't you just stop? Which is very stigmatizing. What if we ask, what is the hardest part about trying to stay away from substance right now? Okay, so you see, when we ask, what is the hardest part about trying to stay away from substance right now? Our loved ones are going to begin to see that we actually care. And they know. Okay, it is the language. We care, all right, but it is how we ask and how we attempt to support them that makes the difference. And so today, one of the takeaways is understanding how we can use language to support, to communicate, and then invite them into our fold and have them understand that we are actually trying to understand what is beneath the surface, what is beneath the iceberg. We are trying, we are inviting them into a very thoughtful conversation. And that is where true healing begins. Okay, let's look at affirmation. When a family is in crisis, it is easy to focus only on what is going wrong. And most of the time, we do that because we don't understand the disease. We are not blaming anyone here. It is difficult. It is very hard. Okay. But affirmations involve spotting the small wins or strength that the addiction often hides. This builds the loved one's self-efficacy, their belief that they can change. So let's look at how we can do this. Instead of, it's about time you clean up the kitchen, let's try, I noticed you took care of the house today, even though I know you've been feeling low. I really appreciate that. Okay. So you look for something they've done positive. It could be something so small. We can start with that. Okay. Give them some affirmation. Yes, we have noticed that you're trying, and we appreciate that. Okay. Then we can move on to the other things that we want to address. Or ignoring a day of sobriety because that is what they should be doing anyway. Yeah, this came from your meeting. Okay. I expect you to keep doing this. This is the way it should be. What if we'd rather say, I see how hard you are working to manage your stress without turning to alcohol. Your persistence is impressive. Affirm their efforts. Give notice to their efforts because they are struggling. Remember what the struggles that we don't see that are hidden. Remember that they don't have control. They are vulnerable. Our loved ones are vulnerable. So we need to learn this tool and communicate with them in a way that can help them to be more trusting and to be able to share with us what is beneath that we don't know and we don't see. Then there's one we call reflections. This is the most powerful tool for de-escalation. Reflections are like a mirror. Let's look at how it looks like. You repeat back the feelings of meaning behind what is said. It proves you are actually listening and helps lower their defenses. So let's look at one example. Your loved one. Everyone is constantly on my back. I can't even breathe in this house. Okay? So, because of our frustration, we might be doing things and saying things that make them feel that way. So now, this is their position. This is what they're expressing. They're also frustrated. Okay? So, how do we respond? Let's see. So, you, the family member, the loved one that you're trying to support, the individual who is struggling. This is how you can do this. It feels like you don't have any space of freedom. So you're trying to let them hear what they are saying from a more positive and supportive perspective. It feels like you don't have any space of freedom here. Or we can even go deeper. It sounds like you are feeling overwhelmed by the expectations and you are craving some trust. And when we're able to do this, our loved ones will feel that they are being heard and they are less likely to yell and be more likely to explain. Because once we come from this angle of speaking to them, being more reflective, they hear themselves and then they begin to explain their position. And we're able to also support them. Okay. And then the last one here is summaries. Okay. Summaries are used to wrap up a conversation so both parties live with same understanding in family dynamics. This prevents debates. I thought you said arguments later on. Okay. It also helps transition from a difficult emotional talk to an action plan. Let's see how this looks like. Let me see if I have this right. You are feeling really stressed about work, which is making the cravings stronger. Or you are frustrated with me because you feel I'm hovering, but you're also willing to call your sponsor tonight if things get worse. Did I miss anything? Mm, That is you clarifying, inviting more conversation. Okay. Now, this tool requires a lot of practice. So I encourage you to also attend the next session because this way you can practice and learn how to use this tool to engage our loved ones who are struggling with the disease. Now, let's look at the evidence-based treatment path. So like I shared with you earlier, we do have the medical detox. So this is where physically we help these individuals when they walk through the doors to start their treatment journey with TIPA protocols. So here it's very brief. They complete their TIPA protocols and then they move to the clinical stabilization services. So this is also a 2027 post-detox stabilization. So it is short term, but it's very intensive. And this is where the work begins, like I said earlier. So here they learn about their behaviors that are driving the disease of addiction. They learn about how addiction impacts their life, and then they begin to learn different coping mechanisms to manage those behaviors, in addition to medication management. So when they complete this phase of treatment, then they either move to the residential treatment, the RS, where if they have comorbid condition, um, they have mental health challenges and substance use disorders. Or they can also go to the outpatient. And here people can live from their homes, those who have a place to live, a stable environment that can also foster treatment. They can go to those homes and then seek treatment, come to IOP, which is also pretty intensive, more meetings, group sessions, and then meet with individual therapists. And then we also have the medication-assisted treatment. So individuals use FDA-approved medications. We have buprenorphine, naltrexone, and other medications to reduce the cravings and overdose risk. So these are all evidence-based treatment paths that are available for loved ones who are dealing with the disease of addiction. Okay, let's look at the importance of family self-care. Usually, there are a lot of studies that show that most of our loved ones, when they are struggling with the disease and we attempt to support them, we see a lot of burnout and break strained relationships in those family dynamics. Okay, and so let's look at how families who are attempting to support their loved ones can also take care of themselves. Okay, so you can provide a much stronger safety net for your loved one when you aren't running on fumes. So when you have no good for yourself, how can you support your loved one? Okay, so we have to learn how to also be mindful of that. So finding your community, you're not alone. We want you to understand that. Okay, isolation is the fuel for family burnout. Connecting with others who just get it can be a life-changing event. So there are a lot of resources in our communities. So want to encourage you to connect. For instance, the Al-Anon and then the Na-Anon are all for families, families of individuals who are dealing with addiction, substance use. So find these peer support groups, okay, and join them with your families so that you can also go and then support each other, share aspirations, share challenges, and find strength to continue to be there for your loved ones. Okay. And so here, these groups or resources are time-tested spaces to share experiences and find strength in a shared journey. We also have the Smart Recovery Family and Friends. One of my favorite resources. It's a science-based, practical approach to managing the stress of a loved one's substance use. So they're out there, research them and connect with them. Okay, and then also individual therapy, which I have shared about our continuum of care. So here you can also go and process the trauma and stress of living with an individual who is also dealing with substance use disorder. Okay, so these are also there for the families or the families who are also supporting their loved ones dealing with the disease. So we want to encourage you to explore them, connect with them, and then so that you can also find strength to continue to be there for your loved ones. Okay, so before I conclude everything, those questions I asked, I hope by now you do have a clear understanding that addiction is a disease. So now, hopefully, we can understand that just asking our loved ones, why can't you stop? We are tired of you. I don't need you around anymore. Don't call me anymore. You know, you say this all the time. I hope today you have understood that when there is addiction is activated, okay, when it is present, our loved ones don't have that ability to make those sound decisions. They don't have that ability, okay, to disrupt those impulses to use the cravings, the urges. Okay, so think of the iceberg analogy. What is beneath, the struggles beneath, the feelings, the frustrations, the unresolved trauma, abuse. We can go on and go on. So beneath, they are dealing with a lot more than we can see. Okay, so this condition, this vicious disease of addiction, which is a disease, it's a condition that is not a choice. Okay, it requires a long-term treatment, supports, and then our support also requires boundaries. Okay, we have to learn the language and also set healthy boundaries so that we are able to also remain in good health to be able to support them. We have to set boundaries to encourage them taking responsibility, but not in a way that is stigmatizing, but in a way that is reaffirming, is reassuring that we are still going to be there for them. Okay, call to action. So here, I'm encouraging you to reach out to a professional today if you're in crisis. If you feel like you're getting burnout, if you feel like you're getting frustrated, if you feel like you have tried everything and you are at a point that you want to cut ties with your loved one, reach out. We can share resources for you. And then these resources are also there for you. Okay, you can call this hotline 1-800-662-HELP or 1-800-662-4357. Or the crisis test line also is here. Text home to 741-741. And then you will be connected with professionals that can also support you. I will end here. I want to thank you all. These are the resources that I used for my research. And I want to thank you. And at this point, I will take questions. And then if anybody also have contributions, I will invite you to share or ask your questions. And if there are questions in the chat too, would like to read them and provide some feedback or answers. Thank you very much.
Thanks, George.
Thank you.
Yeah, if anyone has any last questions for George, you can put them in the chat. Are you okay with us me sharing the PowerPoint with them in the attendee
Yeah.
dashboard? Okay, great.
Yes.
So you all can kind of look back on those resources that he shared and some of those examples of questions to ask. I'll put that in the attendee dashboard. So when you get that follow-up email after this, you'll see a link there in your dashboard. So awesome. Well, if there's no more questions, George, thank you. I hope you have a wonderful rest of your evening. And I hope you all will be back next Tuesday for some other questions and support. So thank you all. Have a good evening.